segment is sponsored by Charleston Orthodontic Specialist. It is never too early or too late to consult an orthodontist. We've got Dr. Patel from Charleston Orthodontic Specialist here to talk about different types of bites. Good to see you.
Good to see you as well.
Right, so a lot of times, you know, I'm no orthodontist, obviously, but teeth are crowded or they're crooked, and you can say, like, that person needs to see an orthodontist. But sometimes it can be a little more subtle, and you're talking about different types of bites that you can correct that, obviously.
Right, so there's many different type of bites that an individual can have. And it's really important to be aware of these different bites, especially if you're an adult or a parent of a child, and try to see if it needs to be treated early. So to go to an orthodontist a little earlier and to be aware of these bites to know when to go.
Right. Just a quick question. If you don't correct it, like, what can happen?
Sometimes there's a huge deficiency skeletally in terms of getting that bite proper. And so there's issues with just biting. Sometimes you can have trauma to the teeth as well. So it's just really important to try to go to an orthodontist and get that checked out.
Right. So what kind of issues should adults and parents look for?
Right. So with an overbite, you have your top teeth overlapping your bottom teeth. And sometimes if the lower teeth are hitting the roof of your mouth, that can cause some trauma to the tissue in the roof of your mouth, and therefore you'd want to get that corrected.
Right. And I know we have a picture of a little kid with an overbite. Is this pretty common that you see with overbites?
Yeah, definitely. It's very common in terms of the lower teeth just impinging on that top teeth or the top tissue. And then here you can see buck teeth, which is when the front upper teeth are protruding. And so children are more prone to falling and injuring those teeth. And so you'd want to get that corrected.
I mean,
as
my
well.
9-year-old looked like that until she had phase 1 braces with you guys. Seriously, you pulled him back in. So you have the overbite. The opposite of that is an underbite.
Correct.
Is that as common?
Not as common, but you'll see the lower teeth in front of the top teeth. That could be due to issues with deficient growth of the upper jaw, excessive growth of the lower jaw, or just the angulation of the teeth. And so we also want to try to direct growth to help out with those issues.
So how do you correct it? Overbite or underbite? What do you do?
With conventional braces, it really helps out. We have special appliances that can help out, and even Invisalign helps too. So there's many products out there that can really help out.
Right, you've got the braces, you've got the rubber bands, all very familiar to us.
Definitely.
There's another one that I hadn't heard of. This is an open bite.
Open
I'm
bite.
going to show a picture. What does that mean?
As you can see from the picture here, just your lower teeth in the front are not contacting your upper teeth in the front, and that can be due to issues with airway obstruction, and someone could be a mouth breather. Other times, if you have habits such as sucking your thumb, or if you protrude your tongue out, tongue thrusting, it's really important to go to the orthodontist once again, if you do see something like that, to try to get those upper and lower teeth to contact so that you're able to even bite on proper food.
Right. So as far as fixing it, we saw traditional braces, but also Invisalign. I feel like everyone I know is doing Invisalign right now. It's so popular. How does it work?
Yeah, so Invisalign from back in the day used to treat just minor crowding cases or some spacing, but nowadays with the technology that they've advanced with, there's so many different complex cases they can work with. You wear these trays and you change them once a week. They have some clear attachments on them sometimes to really grip onto those teeth. And it's just a more aesthetic way to really fix these bites.
I did it for like 6 months. Well, I had braces as a kid, and then I didn't wear the retainer. So wear your retainers. But Invisalign, so great, so easy. Now's the chance, great chance. You guys have a special going on for braces or Invisalign. Tell me more.
Yeah, so with comprehensive braces or comprehensive Invisalign, along with Invisalign Teen, we offer that at Charleston Orthodontic Specialist for $39.95. And then we also offer Invisalign Lite, which is 6 months or less of Invisalign treatment, and that's $29.95.
Right, you can go to itrustcos.com or 843-4braces. You guys have locations all over the Low Country, so there's a Charleston Orthodontic Specialist near you for sure. Always so good to see you. Have a wonderful weekend.
You too as well.
We get a quick break, more Low Country Live right after this.